Is a minute after 10:30. Looks like we've got a pretty good crowd on hand, so we will not keep folks waiting. We'll go ahead and get started and welcome in Dr. Patrick Jackson, who is one of our infectious disease experts we've had on a couple times over the last about 6 months or so to talk about the latest on bird flu and a thought with cases being reported as close to Charlottesville as the Richmond Zoo, with flocks being implicated out on the eastern shore of Virginia, as well as Maryland and Virginia, and I'm sorry, and Delaware. It would be a good time to have him back on to sort of share the latest about what we know and what people need to know. So I guess Dr. Jackson, we'll start there. As I mentioned over the past few weeks here in January, bird flu has been detected in birds in the Metro Richmond area at the Richmond Zoo, Eastern Shore of Virginia, in I know in poultry in both Maryland and Delaware. So for folks living kind of in and around Virginia, what does the fact that now bird flu has been spotted closer to home mean for people who live here in the region?
Yeah, I don't think this really changes the picture very much. We've known for a long time that H5N1 influenza in its current strain is kind of widely distributed in wild bird populations. So the fact that it's been detected in some poultry operations here in Virginia is, I think, one of the things that you would expect to happen sooner or later. The involvement with birds at the Richmond Zoo is obviously unfortunate, but I think it's a predictable consequence of when animals have contact with wild bird populations. And so I think that this doesn't really provide us new information or change our risk level in Virginia.
You mentioned, of course, the most prevalent strain of the bird flu, which is H5N1. But also, for folks who may not have seen it earlier this week, there was a reported H5N9 bird flu outbreak that was reported on a duck farm in California. Can you tell us anything at all about how this strain is maybe different from H5N1?
Yeah, so there's always circulating different strains of influenza in wild animal populations kind of persistently. The H5N9 bird flu has been seen previously and is thought to be somewhat less virulent than H5N1 with a more restricted range. The fact that it's popping up now in the United States and has been detected in that population, I think again, is not wholly unexpected, but every time you have co-circulating strains of influenza, you give the virus a chance to reshuffle its genome and possibly to become more transmissible and change its characteristics. So this, again, not a shocking or kind of unexpected development, but also not a great sign either, because we don't want co-circulating influenza in any population, birds or cows or humans.
We have gotten a couple of questions from reporters, and I know we've just been talking about sort of, the reporting that has been out there about, different strains where it's been spotted. Had a couple questions from a couple different reporters related to what, some people are calling a blackout or a temporary pause in communications from places like CDC. And so really just a question there about, kind of what does that mean and what, concern should there be about that?
So what we really need to have happening right now is CDC working closely with state and local health departments and agricultural departments to do good monitoring about what's going on in wild bird populations, in cattle, collecting information about human cases as well, and then disseminating that information to the broader community. I think right now it's not clear, given the recent changes in DC, what portions of those activities are still going on at CDC and kind of how that communication is coming out. So I think that uncertainty does kind of put us in a more difficult situation.
Understood. A question from one of the reporters and focusing in on sort of the precautions that people should take to reduce their risk. So what if any extra precautions should people take to not bring this in sort of into their homes? I think one of the questions was, should people kind of take their um, should they take their shoes off? How should people monitor and how should people monitor their house pets?
Sure.
Knowing that folks are outside and and often your animals are outside as well.
So I think the populations that are at greatest risk right now are folks who are in agricultural work, specifically people who work with cattle, and people who come into contact with birds, either in an agricultural context or have backyard chickens, or perhaps hunters. And folks who come into contact with cattle in birds in the workplace should follow kind of recommendations from CDC and local health department and local agricultural departments about how to protect yourselves using appropriate personal protective equipment. People who have kind of backyard chicken flocks should be really aware of how their chickens, et cetera, are doing, and be very cautious in dealing with any animals that look to be sick or animals that are dead. Use appropriate protective equipment in handling those. And hunters also should take appropriate precautions when handling or dressing birds that they've caught. Outside of those areas, if you don't specifically come into contact with cattle or birds, then I don't think there's any particular recommendations. If you're an office worker or a plumber or an electrician, and birds are not part of your everyday life except for occasionally having a chicken sandwich here and there, I don't think there's anything that you need to change about your life in order to protect yourself from bird flu right now.
Thanks for that. One follow-up question going back to the communication question for a second. Another question, just generally, again, there have been some reports, and as you point out, we're not really sure exactly sort of what is happening and not happening. But a question, knowing that one of the things, that the CDC and other federal health agencies produce are, studies on things like bird flu. How important are, just in general terms, how important are those studies like this during a time of, outbreak about bird flu or really, about any kind of communicable disease?
I think they're absolutely essential. So, one of the major publications that most of us look for in the field is the CDC's MMWR, or Morbidity and Mortality Weekly Report. So it's a weekly publication, as the name indicates, about kind of public health threats and infectious diseases and things like that. And kind of in an unprecedented way, we haven't had an issue since January 2nd. And this really is one of the major routes of communication from CDC about things like foodborne outbreaks or chikungunya or dengue in the United States, and would also be a route of communication about the current status of avian influenza. I also, CDC also does publish some more formal academic journals in a traditional way, and a lot of that has been on pause. And so I think there's just a lot of uncertainty about to what extent this is a change in routine communications, but emergency communications would get through, versus kind of a more wholesale kind of lack of functioning over at the CDC. So I think it's really important to get clarity about what's going on, and frankly, getting CDC up and running at full speed is going to be essential to keep track of avian influenza.
Gotcha. Thanks for that. You mentioned, I mean, I got a related question from a reporter as well, but what is your sense, knowing that I know we talk about this as avian flu, but also has been, spotted in cattle. Do you have any just general concerns about the food supply, given that there is a version of bird flu that spreads in cows and cattle?
Yeah, I think the most immediate threat to the food supply is in the supply of food, which is, and particularly in eggs. The avian flu is highly pathogenic in birds. And so when the influenza gets into a commercial bird flock, essentially all of the birds are culled to prevent further transmission, and then you have to kind of repopulate. And so maintaining the current supply of eggs is, I think, challenging for producers kind of in this environment. I don't really see any endpoint to that. Avian influenza remains out in wild bird populations. It continues to affect, flocks of chickens, et cetera. And so I think that's going to be an ongoing sort of issue. In terms of cattle, we know that the virus is highly concentrated in cow milk. We also know that the virus is efficiently inactivated by pasteurization. We know that live virus does exist in raw cow milk. It turns out that it seems that there's been probably few to no transmissions of avian influenza in raw cow milk to humans. And that probably has to do with the fact that the receptors that the virus currently wants to use to get into cells, it doesn't come into contact with that if you're drinking milk, even raw milk that does contain live virus. However, we also know that cats in a couple of instances have gotten quite sick and died from exposure to raw cow milk, and they've acquired avian influenza. So that virus is there, and changes in that virus over time could pose a threat. And so I think that I would personally avoid raw milk for a number of reasons, and I would add avian influenza to that list. And to the extent that raw milk may be more widely distributed in the future, I think that that potential risk would increase.
Um, we've had a few questions come in. I'll try to package these together into sort of a grouping around what you see as kind of the current risk level for humans. Yeah, I'll start with this one. To this point, I think the primary concern is kind of, the primary impact, at least, of bird flu has really been, on egg prices, poultry prices. And do you think that's still kind of the primary issue we're facing, or do you think kind of the human health component could become a more significant concern as we move forward?
So, right now, I think that the impact on egg prices is happening and will continue to happen for the foreseeable future. So far, we have not seen sustained human to human transmission of H5N1 influenza. And that really would be the bright red flag that would make you concerned about the beginning of a pandemic. That being said, there is no bright line between the situation now and the onset of human to human transmission. That could happen, never. It could happen tomorrow. So, kind of given the information that we have in front of us, I think it's fair to say that avian influenza is a low threat, but it could be relatively short journey between low threat to being very concerning. In terms of my day-to-day life, I spend more time worrying about the Fifth Street Wawa opening as an immediate threat to my safety and well-being than I do about avian influenza. But again, that could change in the future.
Thanks. And yes, having driven there, I completely understand. For the reporters who are not from Charlottesville, you probably cannot fully appreciate what the traffic looks like at that intersection already. So a couple questions, kind of related risk questions. One is there an elevated level of risk for folks with higher chances of exposure to waterfowl, like people who live or work near waterways? And what about for people, who work, on farms and otherwise with birds in some form or capacity?
So certainly there's higher risk for people who work on farms and with birds. And there already are existing recommendations about personal protective equipment that people should use if you're working on poultry farms or in the processing of poultry products. And I would I would extend that to people who have backyard chickens, of whom there's quite a few, and those chickens can come into contact with wild birds, and kind of the same sort of situation can apply. So worth being very careful about kind of the safety and health of your birds. Waterfowl are a little bit of an interesting situation in that waterfowl don't seem to get as sick quite as quickly as chickens do, and so you're less able to kind of understand kind of what the risk level looking at a duck versus looking at a chicken who's not going to be doing so hot if it's infected with influenza. I think people who are duck hunters should certainly kind of have awareness of avian influenza and follow recommendations in dressing any ducks that they get. I think that if your contact with waterfowl is seeing some ducks in the distance or things along those lines, then probably not an elevated risk relative to other people. So I think it really kind of depends on how directly you're contacting birds.
Gotcha. Let's see. Oh, the other thing, again, kind of related to risk, from one of the reporters, what types of indicators are you going to be looking for as you consider if for humans, our risk level is increasing?
Yeah, I think if you start seeing cases where you're having human infections and it looks like those human infections are being transmitted from person to person in a sustained way, then that's really the bright the bright red flag that makes you think that we might have a pandemic starting to get kicking off. So far, we have not seen that. The human infections that have happened have kind of come from cattle, or they've come from birds and they've been a dead end for the virus and you haven't transmitted from person to person. But if the virus is able to kind of overcome that barrier, become adapted to humans and be able to transmit from human to human, that's really when you start to see a big change.
Another question from one of the reporters. I know you talked a little bit about precautions before, and one of the reporters was asking if there's anything people need to know about, kind of cleaning as a means of helping to prevent illness. Should parents take precautions, like as an example, like cleaning outdoor play equipment for their kids? And if so, are there particular cleaning agents that we know are more effective against something like the bird flu?
That's an interesting question. Um, I can't think of a particular need to do that. I mean, I suppose if you walk outside and it's like, Hitchcock's The Birds and your playground is completely covered, then maybe you want to wipe things down. Influenza doesn't survive very well just in the environment on solid surfaces, so that's not kind of a major route of transmission. There are certainly other viruses and other sort of pathogens to be concerned about. Right now, in terms of playground equipment, I'd be more concerned about norovirus than I'd be concerned about avian influenza. But I don't think that for bird flu, I would change anything about kind of cleaning, unless outside of kind of the context of, chicken farms.
Gotcha. Um, we, I think, have largely caught up to all the questions that folks have asked in chat, but if there are any additional questions for Dr. Jackson, go ahead and throw those in chat here as we move towards 11 o'clock. I will just throw in this one, Dr. Jackson, mainly because I was curious. What do you know about bird flu? I know when we think about like kind of typical like human influenza, like it is generally considered like a seasonal, it's something you get in the winter. Is bird flu the same, or is it more of a kind of a year-round type illness that is not necessarily tied to a particular season?
Yeah, I thought this was a really interesting question. And so it turns out that, yes, there is some seasonality in bird populations to bird flu. So, fundamentally, we don't really understand why influenza is so seasonal. There's a bunch of factors that could play a role. We think that, for example, lower humidity, lower levels of UV light, and cooler temperatures make it easier for the virus to survive in the air and to be transmitted from person to person. Birds also change their behavior seasonally, right? There's birds migrate or they overwinter in large flocks populations. So combinations of probably environmental and behavioral factors do change the prevalence of influenza in bird populations over the course of the year. To be honest with you, I couldn't tell you the magnitude of that change. I don't think it's like, it's not like humans where essentially there is no circulating influenza A in July, and there's a ton of it in January. But there probably are some fluctuations over the course of the year.
All right, great. We'll put out a last call here for any more questions for Dr. Jackson. Thanks as always for taking a few minutes to kind of run through this. I know this was one I heard from a lot of folks in advance who were interested in hearing from you on this. So this has been great. And not seeing anything else, we will go ahead and wrap up for this week. So Dr. Jackson, thank you again. Thanks for everyone for joining us.